Hi, my name is Tori Johnson, and today I'm going to be demonstrating the skill of IV med push. First, I would start off by following all GPSP guidelines, all my 11 rights to myself and my patient, and all 3 medication checks will be done. Okay, so I would enter my patient's room. Hi, I'm Tori. I'm going to be your nurse today. At this time, I would explain to my patient that they've been ordered medication to be pushed through their IV. I would do my hand hygiene, put on gloves. I did come into the room with the medication already pre-drawn. That was my first check to the patient MAR. While checking the MAR, I also made sure that there was no interactions with the compatibility of the medications. So at this time, I would identify my patient by the 2 identifiers, which are name and date of birth. That matches my patient's wristband. At this time, I would assess their IV site, make sure that we're not having any infiltration, any irritation, pain from the patient. They verbalize that they're having no problems with their IV. Okay, so let's get started. Hand hygiene gloves. Okay, so first, I'm going to take the port closest to the IV, remove that cap, scrub the hub and let that air dry. And I am maintaining a aseptic technique this entire time. I also have done all proper assessments for the medication and allergy assessment for my patient. Okay, so then we will insert this first saline flush. I'm going to draw back and make sure that I get blood return and flush this at a slow rate. Once that is done, we will undo that. Get a new alcohol pad, a new clean alcohol pad. Scrub that hub again and allow to air dry. Okay, so then I'm going to go in with my medication. Okay, so I checked it outside the room, I checked it when I entered the room, and now I'm checking it before administering. It is the right medication for the right patient and the right dose at the right time. Okay, scrub that hub with a new clean wipe. Okay. And I did contaminate, so now I'm going to clean this end with a new clean wipe as well. I'm going to allow time for both of these to air dry. And I'm going to insert that, and I'm going to push this medication as ordered per the MAR. Okay. Once that is complete, this is a new clean alcohol swab. Scrub that hub one more time. Allow that to dry. Okay. And then this last flush, I'm going to go in at the same rate that the medication went in. I'm assessing my patient this entire time, making sure there's no infiltration, irritation, or problems at their IV site. I'm also assessing with my patient that they feel okay and aren't having any noticeable adverse reactions from the medication. Okay, now I'm going to clean this with a new clean alcohol swab. Okay, I would get a new disinfectant cap that is clean. And apply that there. Okay, so after that, I would set their flow back on their IV to what it was if it was ordered to have original. Back to original. Okay, remove my gloves, perform hand hygiene. I would clean up all of my supplies. I would assess my patient, make sure they are feeling okay, no adverse reactions. I would record and report properly from all the medication and give them any education that they would need after this. Okay, so then I would leave the room. I would report immediately and then come back to reassess periodically after from the medication. Okay, so then I would leave the room. And now this patient has been ordered an IV piggyback. So I would approach the patient room, once again following all GPSP guidelines. all the 11 rights to myself and my patient, all 3 med checks, all proper assessments for my patient or the medication. Okay, so we'll get started. I would walk in, introduce myself as their nurse today, perform hand hygiene, and educate them that they have been ordered a piggyback medication through their IV, and answer any questions that they had about that. Give them the proper education. So I would come in with all of my supplies. Once again, I have already, before coming into the room, checked the medication to the MAR. This time I would assess any allergies with my patient, any assessments needed for the IV, make sure there's no infiltration, pain, or any abnormalities happening with my patient. I also have assessed and made sure that there is no that there is compatibility with the medications that they're already on to what's been ordered. Okay, and then let's get started. I've done hand hygiene, I've donned my gloves. I'm going to assess the IV site. Looks good. My patient is not in any pain and they don't have any questions for me. Okay, so then I'm going to start by moving my primary tubing down. And we are going to stop the flow of their fluids. Then I will get my medication, and at this time I would do my second check that I have the proper medication, right dose, and the right patient. We will hang that here. Oh, no, we won't. Sorry. Okay. And I'm going to spike this bag. This would have a cap on it. I would remove that. Remove this. I'm maintaining aseptic technique this entire time. And I would spike that bag without contaminating or touching the spike. Then I will hang my medication, making sure that my tubing is untangled. Okay. Then we're going to connect this tubing. I'm going to go ahead and remove this cap. Scrub this hub with a clean alcohol swab. Remove that cap. Get a new clean alcohol swab. Scrub that cap or hub and allow those time to dry. I grabbed the wrong one. Okay. So clean. Okay, I'm gonna go up here. I capped that with a new clean cap. And I'm going to take this access port that is closest to the IV pump, clean that with a clean alcohol swab. No, I'm not. Okay, I'm sorry. Okay, so I have my medication. I'm going to make sure that this drip chamber is halfway full. And I'm going to go ahead and prime my tubing, making sure to not release too much of this medication because my patient needs all that was ordered. Okay, tubing is primed. I'm going to take a new clean alcohol swab. Scrub that hub, and this would be a brand new disinfectant cap. We are maintaining asepsis, even though septic technique, even though a little bit finicky. Okay, so we hang that there. Then we come in and we get the port to the IV tubing that is closest to the IV pump. We will scrub that hub, allow that time to dry. I'll get my medication tubing, remove this cap. I'm going to go ahead and disinfect that just in case and allow that time to dry. So then we will get that inserted here. And before I put this through to my patient, I'm going to do third final check that I have the right medication, the right patient, the right dose, and the right time. Okay, there's no kinks in my tubing. Everything should flow nicely. That one is off, and then once I start this, and start this, okay, we see that this one is flowing, this one is not. I've assessed my patient throughout this entire skill, making sure that there's no issues at their IV site. I would do hand hygiene, clean up, and I would assess my patient, making sure that they're feeling okay, not having any adverse reactions from the medications. There's no contamination, no all of the medications or fluids they've been on are compatible. So I would leave the room, answer any patient questions, leave the room, report and record immediately, and come back periodically to assess my patient. Okay. So I would leave the room, okay, and then I'm going to come back in my patient room, and I have noticed that they are done with their medication and it's no longer dripping. So we are going to discontinue this medication. I'm going to do my hand hygiene. Once again, I'm going to identify my patient, making sure that I have their name and date of birth. I'm going to first assess my patient, make sure they're feeling okay from their medication and there's no emergency scenarios that need to be handled. Okay, so then I'm going to put on my gloves. And I'm assessing the IV site also, making sure that we have no infiltration, no pain at the site, no abnormal redness, swelling, or irritation. My patient states that they are feeling good and everything is fine and they have no questions. Okay, so now I'm going to come in here, and we're going to stop this. This is no longer dripping. Going to remove that. I'm going to get a new clean alcohol swab, scrub that hub, and put on a new clean disinfectant cap. So we'll do that, and I allow that time to dry. Put their fluids back to their original. Okay, then I will take this, and I will dispose of this per facility policy. Okay, I'm going to make sure that this is half full. Got all my tubing is straight. I'm assessing my patient from their medication. They're having no adverse reactions, and they have no further questions about their medication. There's a kink in the tubing. Okay, so there's no air bubbles, everything looks good. I dispose of that per facility policy, and I am going to set the flow rate back to its original for the fluids if ordered, and then we will start their IV. Okay, and as you can see, this is dripping now. I'll remove my gloves, perform hand hygiene. I would answer any questions that my patient had, provide them with any education that they had. Once again, I've assessed the site, I've assessed and evaluated their reaction from their medication. I've discontinued per facility policy for their medication or disposed of. And throughout all of this procedure, medication and fluids, the flow rate was set at what was prescribed. All 3 checks were done, asepsis was maintained, and the 11 rights to my patient were followed. I would leave the room, record and report, educate my patient on any questions that they had, and always put safety first.